And along with fellow health officers across the Bay Area, today I'm here to describe this new health officer order that we're issuing across the region, and as James mentioned, that will take effect on Monday, May 4th. But before I do so, I want to just pause and recognize just how far we have come and to express my gratitude for the collective sacrifice that has averted a catastrophe in our region. So in preparation for my remarks this morning, I was reflecting and reviewing all that's happened since January. So recall that on February 4th, Santa Clara County had 2 of the 11 confirmed cases of COVID-19 in the entire United States. That's 18%. That's our share of cases on February 4th. And by the end of February, we had documented what we then thought to be the second case of community transmission in the entire country. But we now know that community transmission was already occurring in January, and that the first death in the country was in fact on February 7th and in a resident of our county. So my point here is just to remind us all that here in Santa Clara County, we got something of a head start in this pandemic. But through gradual and collective action, starting with voluntary working from home and culminating in sheltering in place for the last 6 weeks, we have slowed the spread, flattened the curve, preserved our hospital capacity, and prevented many, many deaths. Our county now accounts for less than 5% of the cases in California and just a tiny fraction of the over 1 million cases across the United States. The new order that will take effect next week is designed to preserve the progress that we've made, to continue to prevent a surge in cases, and to gradually ease restrictions, allowing for a few additional businesses and activities to take place. But to be successful, we must ensure that we have a robust infrastructure in place to transition to containment, and our case numbers must remain low to make it feasible. We must proceed slowly as we are continuing to learn more about the epidemiology and clinical severity of COVID, and as we monitor the indicators, which I'll describe shortly. So we've learned a lot about COVID-19 since we put the order into place. And most notably, we now know that there's a very significant degree of asymptomatic infection. This means that we need to do even more testing to figure out who is infectious, and even more case and contact tracing to ensure that people who are infectious are safely away from others. We've also learned that it's not just older people and those with chronic medical conditions that may suffer from COVID-19. Recently, and again, thanks to our partners in the media in large part, we've learned many things, including that young and previously healthy individuals have suffered from strokes and other poor health outcomes. So we have much, much more to learn. We also continue to learn from experiences across the world, and we understand that many areas have suffered a sharp resurgence in cases when they have lifted shelter in place too soon. If we move too fast to ease restrictions, the potential for exponential spread could have grave impacts to the health and wellness of our residents as well as to our economy. And of course, a vaccine is still a long way off, and virtually our entire population is still at risk. So our region has developed 5 indicators which we'll be monitoring in our counties and across the region. We'll be monitoring disease activity, healthcare infrastructure to respond to a surge, as well as public health infrastructure needed to successfully transition to containment. But ultimately, our goal is to move from more broad-based mitigation to a more focused approach. So here's what we'll be looking at. 1, whether the total number of cases in the community is flat or decreasing. 2, whether the number of hospitalized patients with COVID is flat or decreasing. 3, whether there is an adequate supply of personal protective equipment to protect all healthcare workers. 4, whether we're meeting the need for testing, especially for people in vulnerable populations or those in high-risk settings or occupations. And 5, whether we have the capacity to investigate all COVID-19 cases and trace all of their contacts isolating those who test positive, and quarantining the people who may have been exposed. So we've already made significant progress on many of these indicators, and we need to ensure that we don't slip backwards. Our goal is to gingerly chart a course to be the most health protective. We recognize that we can now better measure the health impacts of COVID-19, but much more complex will be to measure the health impact of shelter in place and our other measures. We know that the social and economic disruption of shelter in place have short, medium, and long-term health consequences, but they're of course much more difficult to measure. Our plan is to go slow, learn all that we can, and continue to work across sectors and all levels of government to rapidly stand up the infrastructure and systems that we need and to chart the best path forward to protect and preserve the health of the residents that we all collectively serve. Thank you.